Thank you and happy Easter. Today is Good Friday. I want to thank all of you for being here today, and for those of you who are on our Zoom application, our reporters, thank you. And to those Mississippians that are tuning in, I want to wish you a happy Good Friday, and thanks for being with us. We've spent today and much of the last week working on our COVID-19 system of care plans. I just left a meeting, sorry we're a few minutes late, led by Dr. Hayes, the president of the Mississippi State Medical Association, and Dr. Claude Brunson, who is the director of the Mississippi State Medical Association. Our top priority throughout this entire process has been preventing our healthcare system from being overloaded. We will not be able to prevent every COVID-19 death. We believe that we will be able to prevent a breakdown of our healthcare system, a breakdown that we have seen in some other countries. Everyone who might survive this virus with quality care should get that care. I think that we are so far successful in that effort. There's a lot more work to do. The peak is coming soon. I'm going to ask our COVID-19 response team to provide an update on their work in just a moment. I also want to warn people that just because COVID-19 is at the top of the news, other threats do not stop. We are facing severe weather in Mississippi this weekend. We heard a report earlier on our 9 a.m. call from the Weather Service. Large hail and violent tornadoes are threats in just about every single region of our state on Easter Sunday. It is more important than ever to be prepared, to stay home, and to stay safe. Please be smart and take care of your families. Be weather aware this entire weekend. Our emergency responders and healthcare workers are ready and they are engaged. They will be there to take care of you, but there is no replacement for personal preparedness. Please take care of your family proactively as we enter what could become a very dangerous weekend. I also want to talk about something that's been on the top of many minds over the last few hours. In Greenville, we saw a local official send the police to issue tickets for churchgoers who were trying their best to comply with our executive order. They were trying to do right. They were in cars, windows up, listening on the radio. I've shared my personal worries and concerns about those services because it's hard to keep people from socializing once you put them in cars so close to their friends. I personally wouldn't hold one if I was a pastor, but I don't think what was happening on this Sunday, based on what I've seen, is in violation of my original order. I've been clear that no American government has the right to threaten to lock someone up for practicing their faith. That is not legal, and it is not right. In Mississippi, churches are protected from over-the-top actions like these that is spelled out in our executive order. I've said many, many times, and I'm going to say it again, and I will admit it pains me to do so, but I do not think anyone should attend gatherings of any type, including church services with more than 10 people there. But this is still America. We still hold our religious liberties dear. I'll be happy to answer questions about that, but I want to make clear for all local officials who are wondering as we enter the second week of shelter in place and Easter Sunday, Mississippi is not a state that uses government threats to shut down churches. I personally plan to worship from home on Sunday with my family. We never missed Easter service before, and we won't miss the chance to worship in our home. I hope all Mississippians will celebrate responsibly and take precautions to stay safe. Stay home if you can. Worship from home. Please use common sense. Be smart. Look out for your loved ones. I want you to know today also that we have taken some additional measures to prevent the spread of COVID-19 that I want to make you aware of. We are suspending both political parties' nominating conventions in Mississippi this year. We were asked to do so by both political parties. We are also suspending the requirement that businesses hold in-person shareholder meetings. Those are not necessary at this time. I also want to mention some additional measures that we are taking to prepare for the potential surge of COVID-19 patients in our healthcare system. We know that the experts are taking the lead here, so I've taken a few additional actions to help support them. At the request of the Mississippi Forestry Commission, we've issued a proclamation prohibiting any outdoor burning in the state of Mississippi. They told us that we've got some dry conditions and a recent increase in wildfires. That has diverted EMS professionals from the COVID-19 response. That burn ban is in effect now. I've also just put an executive order behind the Mississippi Department of Health guidelines on elective surgeries in order to prevent the unnecessary use of PPP and healthcare resources in these critical days ahead of us. Those guidelines by the Department of Health have been out there for a while. I think most providers have followed them, but there are always some who refuse until it is mandatory. For the next few weeks, as we hit the critical point when our healthcare system may be the most stressed, now is the time to give that the force of law. I've also signed an executive order which says that our healthcare workers and our facilities cannot be sued for genuinely trying to help a patient during this critical time. We need every protection for these healthcare heroes as all of these doctors and nurses work to adjust to unprecedented times and what might be an unprecedented surge, an unprecedented crisis for our system. There are still avenues for legal remedy if someone willfully does harm or shows reckless disregard for safety. But we want to do everything we can to get doctors engaged in this fight as we hit our peak. It's something that those frontline doctors and nurses have told me is critically necessary for them for the next few weeks as they engage in this unprecedented battle. I'm grateful to the people of this state. Your work and your commitment is having an impact. The spread is slowing, and many believe it is slowing dramatically. Your work is making a difference. Please don't let up. We're not out of the woods yet. We need your help, and we need you to help us keep our fellow Mississippians safe. With that, I'm going to ask Dr. Hayes and Dr. Brunson to walk us through their plans on the COVID-19 system of care. Following that, of course, I'll ask Jim Craig, the Senior Deputy at the Department of Health, followed by Director Michelle of MEMA, to give an update on their preparations for what could be the peak within the next week. Dr. Hayes?
Thank you, Governor. So we have put together a COVID system of care that is statewide. We've involved physician leadership from many organizations around the state. We've worked with the hospital associations. They have been tremendous teammates. We've worked with the nursing association. We work with the emergency medical providers and also the State Department of Health. They are a tremendous resource for our state, and we feel like we're up to the challenge. We look forward to meeting that challenge and to have developed a plan in place to have access critical care physicians all around the state using telemedicine and other resources that we have available. It's critically important, as the governor mentioned, that we continue to do the social distancing and that we stay safe, wash our hands, really take care, because the surge is not here yet. It's coming. We need to be prepared, and we look forward to meeting that challenge as we try to take care of all the citizens of Mississippi. Dr. Brunson.
Thank you, Governor, and thank you, Dr. Hayes, and our Department of Health. I continue to say that through the work that we're doing and through the governor's leadership, especially as we have set up now this COVID-19 system of care, that we are as prepared as any state, and I believe more prepared than most states have been to this point when getting ready to deal with its surge. We have looked around the country and we've learned from other places. We learned the good things that worked, and we've looked at those things that were not as effective. This COVID-19 system of care that we're talking about, I think, is one of the jewels that we've had in our state. We are probably the only state that has had that system of care, a statewide system of care, to deal with acute heart attacks, to deal with trauma. And that system is the one that we took as a template to build the COVID-19 system of care. We were able to overlay this system to give it a statewide map for us to be able to take care of patients. So no matter wherever the patient enters the system, we will be able to get that patient to the right place with the right resources to give them the optimal and possibility to have a good outcome from having gotten an infection, if in fact that's what happens to them. Now, the one thing that we continue to say is to practice all the good preventive measures that you've heard us all say, and you've heard us say it all the time. The best way to have a good outcome during this period is to not get the virus and not get infected. That is the best way that we can take care of you and we can take care of your families. So I'm very pleased about where we are. We continue to do work. We have recently, just today, put out another survey to all physicians across the state to get the demographics of where they are, what status they're in, where they practice, and would they sign up for our registries, such that if we needed to mobilize them, we have all the demographics, we know where they are, we know the kind of practice that they have, and then if we need to mobilize them, call them up to go and work in a hospital A or hospital B, we have that, and we can backfill all those places that we may find holes in the healthcare delivery system. So I think, Governor, we're as prepared as any state. I think our healthcare workforce has stood up. We're ready, and we're ready to provide the care that Mississippians will need. Thank you.
Thank you, Dr. Brunson, and thank you, Dr. Hayes. I gave them a charge less than 2 weeks ago that everyone who might survive this virus with quality care should get that care. And the work that they have put in over the last literally barely 2 weeks has been incredible. We are prepared for this surge. We are doing everything we can to make sure that that quality care exists. And I can't thank these two and their entire COVID-19 task force, which consists of people all over Mississippi, for stepping up to the plate. I can't help but thank every healthcare worker who said, I'm willing to come back if it means I can help my fellow Mississippians. That's what being a Mississippian is all about. And thank you for those who are currently on the front line, and thank you for those who are willing to come back and help, should that be necessary. At this time, I'm going to ask Jim Craig, if he would just talk a little bit from the State Health Department's perspective, he's also been involved, by the way, very involved and engaged in the task force.
And it's been a real pleasure to work with the task force, and thank you, Governor, for an opportunity to visit a little bit today. We do expect to see increasing cases in the next few weeks, but fortunately, our current models indicate that we will have sufficient beds, ICU, and ventilators during this peak period. Now, while that's comforting, preparing for the worst, as you've heard before, includes contingency plans to make beds available. We have contingency plans, but it's vitally important that you stay well and follow the guidance that has been received so that we don't overload our healthcare system. Our alternate care site plan includes working with our rural hospitals to utilize excess beds for patients who no longer need acute care in a hospital. This opens up beds in an acute care hospital that another patient may need. These patients would be able to complete their convalescing or respite care in the rural hospital before returning home. This helps ensure the health of others at home or in long-term care facilities. We are grateful to all of our hospitals, but especially our rural hospitals, for answering this call so quickly. This morning, I visited with a number of hospital administrators. Over 60 hospitals have generously offered their services. This will provide an additional 1,000 beds for these patients with COVID as they recover. As you heard last week, the Mississippi Department of Health, the National Guard, and MEMA are working to develop an alternate care site at Camp Shelby. This is the contingency plan to the contingency plan and will provide up to 200 additional beds at that location. Assessment teams are working in the north yesterday and finishing up some work today to identify some up to 190 to 200 additional beds as the contingency to the contingency plan. I thank you for your attention, and please remember, this is the time to follow all the guidelines from CDC, from the State Department of Health, listening to the governor. Don't let your guard down. Stay healthy and stay safe. Thank you, Governor.
Thank you, Jim, and let me say again, as I have said repeatedly from this room and other places over the last many weeks, it will be a positive outcome if the contingency to the contingency plan is not needed, and it will be a positive outcome if the contingency plan is not needed. But it is our responsibility as leaders in this state. I would much rather be in a position in which we have something that we don't need than to be in the position where we need something that we don't have. That's what all of this planning has been, that has gone into it. It's the reason these men and women on these task forces have spent hours and hours and hours. We hope we don't need it, but we want to have it if we do need it. At this time, I'm going to talk to Director Michelle. Obviously, one of our challenges, just like every other state, is having adequate PPE. We are getting more and more delivered. We are still trying to acquire and procure more PPE, and so I want to give Director Michelle an opportunity to address that. But also, we have a very large team at MEMA that is focused on COVID-19, but we also have to have people that are focused on the pending weather. And that's, for whatever reason, this virus being out there is not stopping the wind from blowing. So, Director Michelle?
Thank you, Governor. Yes, indeed. Unfortunately, COVID has not disrupted the weather patterns that we typically see this time of year, and Sunday's going to be a big day, potentially dangerous day for the state of Mississippi as a severe weather system comes in. As you probably have already seen on the news, and we briefed all of the county emergency management agencies yesterday, briefed the governor this morning, and then had follow-up meetings afterwards. We've got a very dangerous weather system coming in on Sunday morning, and then even more dangerous system that'll come in later that afternoon that has the potential for some very dangerous tornadoes. Fortunately, and with regard to PPE, one of the questions that we are asked a lot about is, do we go to shelters? What do we do? Do we do anything different? No, you don't do anything any different. You go to your shelters if you need to. However, you still need to maintain your social distancing to the best degree that you can. With regard to PPE, we did get very large shipments in from the USAID stockpile that we've been looking for, and thankfully, a large portion of that order was hand sanitizer. We are pushing out county pushes to the points of distribution today, and then we'll be making strategic pushes to the Tier 1 healthcare facilities tomorrow to get ahead of the weather, as we'll be doing a safety stand down on Sunday while this weather passes.
Thank you, Director Michelle, and to everyone up here who has been engaged in this fight. I can't tell you how proud I am of all Mississippians, and particularly those who have stepped up in positions to lead us through this unprecedented event. And so to quote President Trump at his press conference earlier, it is Good Friday, so y'all be nice, but I am going to be happy to answer questions at this time. Courtney Ann.
I know that you mentioned, Director Michelle, that folks don't need to do anything differently in the way of shelters. I know that many of the counties and cities have started saying, go ahead and make that plan now, as you all have said. Is there anything specific to the 10 people or more gathering? Is there just an overall exemption to that because it's an immediate threat versus an imminent threat? What do people need to know?
So, as always, you want to maintain that guidance, but in the midst of life safety and getting to a shelter, life safety has got to come and got to be paramount. So, when entering a shelter, typically, based on our population, generally speaking, the shelters do not get overcrowded during the times of shelter. We'll go back and look at historical times. So, social distancing during these conditions would not be an issue, but life safety has to be in effect at this time. A lot of questions about, well, if I don't have a mask. Well, one of the things, and the governor was asked that last night during the town hall, masks. If you don't have access to an N95, you don't need access to an N95. A surgical mask will be just fine. But an example is I wear a cloth mask that I use at MEMA, and it's washable. And keep in mind, the purpose of a mask is to prevent you from getting water droplets on folks. So maintain the CDC guidance as best you can with social distancing and hand sanitizing, washing your hands, but life safety must be paramount.
Should everyone who's going to a shelter wear a mask?
Absolutely. That would be the desire, that someone wear a mask, or again, a cloth mask is fine. In absence of those things, a bandana is certainly better than nothing. I have a face mask that I wear when I'm riding my bike. That will work. A T-shirt around your face will work. So being resourceful during this period of time is important.
Yeah, and I think that's an important point that we should reiterate. I'm certainly not a medical doctor, but as I appreciate it, healthcare workers that are treating COVID-19 patients need N95 masks. But those of us that are practicing social distancing, if you look at the guidelines, masks such as the ones that you have on or that Director Michelle just talked about, as I appreciate it, are adequate in helping us get through this. There's not enough supply of N95 masks for every American or for everyone on the planet to get an N95 mask every day. It's just the supply is not there, so we got to do the best we can at the time. Renee, do you have a question from the participant?
Hi there. In 2018, many Mississippians reported receiving absentee ballots too late to be able to vote. No matter how the COVID-19 pandemic develops, it's certain that this year's presidential elections are going to involve a surge of absentee voting. What is the state of Mississippi doing to ensure every Mississippian has access to the ballot?
Well, thank you for your question, and I will just remind you that we are currently in the month of April, and we are less than 5 days from the surge of COVID-19. At this point, we are focused our efforts on making sure that we don't put our hospital system at risk, that we have necessary plans in place, and as we move through the summer and into the fall, we will do everything that we possibly can to ensure that every Mississippian that wants to vote has the opportunity to vote.
So, David Elliott from WLOX has a question. David? David?
Governor Reeves, can you hear me?
I can, Dave. Go ahead.
We have 151 school districts, 500,000 students in Mississippi and their parents who are living under a cloud of uncertainty. You closed the schools on March 19th, set an end date for that closing on the 17th of April. You promised a decision by next Tuesday, maybe even earlier. What kind of factors are you weighing in regard to whether or not to just cancel the school year altogether?
Well, thank you, Dave, for that question. It's a very good question and a very important question. I will tell you that when I was first elected lieutenant governor 8.5 years ago, we had 152 school districts. Through school district consolidation, we actually have less than 140 districts today. I'm proud of having made that process. What I have done over the last several days is sat down and not only been talking to hospital administrators and hospital CEOs about what they're seeing in their own facilities, but also I've talked to the chairman of the board of the education board. I've talked to our superintendent of education. I've spoken to individual superintendents, all of whom have been advising me on the various options that we have. In addition to that, I have had conversations with other governors from around the country and communicated with them as to the decision-making process that they went through. It's a critically important decision. I'm going to make a final decision over the weekend. There is no question that I want to get kids back in school as soon as possible because I'm so proud of the progress that's being made in Mississippi in terms of educational achievement. We are outperforming every single other state in 10-year growth numbers, but I'm not going to do anything that I believe puts more Mississippians at risk. And the fact being, we intentionally put an end date. That was a recommendation made to me by many in the education community that we put an end date on when schools would be closed so we would make another decision. It appears right now that our peak resource allocation will be sometime late next week, but our peak number of deaths may not be for some period of time after that because that tends to be a lagging indicator. And so we're looking at all of those factors. I'm also asking all of our education leaders that I'm speaking with to give me an update on distance learning and how many kids are participating and how much learning is really going on right now. And I've got to tell you, I've been very, very pleased and very impressed with the positive stories that I'm hearing from an anecdotal standpoint. Kids in Mississippi are still learning, but that's going to play a role in my ultimate decision as well. Obviously, having confidence that we are seeing a large percentage and a large majority of our kids participating in learning activities will give me more confidence in making that decision. Gerald, did you have a question earlier?
Yes, you talked about the system of care. Could you spell it out in terms that majority of Mississippi can understand? What does this mean? Does this mean that there's a specific hospital designated in each area to care for COVID-19 patients? They get moved to another facility when recovering? Kind of spell that out for them.
Well, yeah, and I'm going to let the physicians do it, but let me do it in the way that I can understand it, because everyone up here is so much more smart than I am. It's hard for me to get it, so it takes me 3 or 4 times. So the way that it has been described to me, that is the easiest way in which to understand in my mind, is sort of the hub and the spoke model. So we have large systems of care in primarily major metropolitan areas, whether it's the coast, it's Hattiesburg, it's Jackson, it's Tupelo, it's the Memphis metropolitan area. You have large facilities with large amounts of capital, with large amounts of resources, and large amounts of physicians, and particularly specialists. And so what you're going to find, I think, in the system of care is, if you have a smaller, more rural hospital that probably has fantastic physicians and fantastic healthcare workers, but don't have as many of them. And so if they were to get a large number of patients, that were too many for that one facility to deal with, they would be able to, much like they do if you have a heart attack, which of course Dr. Hayes can talk to very specifically, but much if you have other trauma, whether it's a stroke or other things, the system of care is in place such that they know who they can communicate with to ensure that they get that patient transferred to that facility that has the necessary resources to deal with it. Similarly, that system of care is also in place because if that patient comes to one of the larger facilities with more resources and gets to a point in their care where they're on the downside of recovery, but yet, so maybe they've come through ICU, maybe they've had a ventilator, maybe they've gotten off the ventilator, they're now breathing on their own, they're doing better, but yet they're not yet ready, or in some instances able to go back home. Well, then maybe the spoke sends it back out to one of the rural facilities so that they spend the last 3 or 4 or 5 days of hospitalization typically closer to where they live, but also in a facility that can handle the level of care that they need. Now, Dr. Hayes, you may want to
Sure. I mean,
fill that in.
It's very much like an operations management or logistics problem. I mean, just, for example, FedEx or UPS or whatever, they're moving things around. And so that's what we're trying to do, is provide the citizens of Mississippi the best access to care. So it's getting the right person to the right people and the right equipment at the right place at the right time. So it's just moving people around so they get the best level of care possible. The governor mentioned the heart attack network. Mississippi has the fewest numbers of physicians per capita in the whole country. So we decided that we needed to do something about it. We needed to work together. And so in cooperation with the hospitals, the physicians got together around the state and said, look, let's see how we can best take care of the patients to get them to the right places. Well, that worked very well, and so we matched that over to stroke. So having that skeletal structure, we said, well, we'll just overlay the COVID system of care, and it works very well. We've had several conversations. The Mississippi Healthcare Alliance has been very instrumental, along with the State Department of Health, in providing that network, and we've had these conversations over the past few days, developing protocols, getting physicians ready. So, for example, if a smaller hospital, say in Louisville, they don't have a specialist, they don't have a cardiologist, they don't have a pulmonary critical care doctor, but they can have access. Maybe we can do that through telemedicine. Maybe that patient can stay in that hospital, or maybe if they can't, well, then we can move them to the right place that they have a bed available. So it's just logistics and operations management to a really high degree.
On the question of churches, you said that cities and police shouldn't be going after churches that are holding services with more than 10 people. So if they shouldn't crack down, what other recourse does these cities have if people are gathering and potentially putting other people at risk for contacting this virus?
Well, the specific example, as I understand it, was a church in Greenville that had a drive-up service in which the participants, and there weren't that many participants, but there were more than 10, I feel certain, but in which the participants were sitting in their vehicle, listening to their preacher preach on a radio station in their vehicle. Their windows were up. They were in the vehicle with just their families. As I appreciate what was done is a large number of police officers showed up, made those individuals lower their windows, ticketed them, handed them the tickets, which obviously made it such that, honestly, I would argue that in some instances the decision by the local elected official put more people at risk because it made them put their window down. It put officers at risk by coming into contact with these individuals. And so what I have said and what I believe to be absolutely true for the next couple of Sundays is I don't think we should have any services. I think that the services that we have should be online. I believe that we should worship at home. I'm going to do a Facebook Live at 9:30 on Sunday morning, just like I have done the last 2 weeks, and give an opportunity to read Scripture and to pray for our national leaders and our state leaders. And I think that is the right approach for everyone in Mississippi to do. But I also think that where you get major pushback by Mississippians is when they are trying to comply with the original executive order, which outlines that churches are protected, just like they are protected under our United States Constitution. They are protected, but they must follow social distancing guidelines, and that's critically important.
But
And so,
I'm sorry, the mayor of Greenville has an order that specifically prohibits drive-in church services.
well, if that is true, and I haven't seen his order, if that is true, and it is in direct conflict of the order that I put in effect, it is not valid. Now, the vast majority of mayors around the state have have had executive orders that go beyond what the state did, and that's perfectly fine. That's perfectly acceptable to go beyond what the state executive order says if and only if it is not in direct conflict with the state order. If the state order says this is an essential business operation or an essential service, then local elected officials cannot directly conflict what the executive order says. It is the reason that we utilize the U.S. Department of Homeland Security's infrastructure task force and cybersecurity task force, and the vast majority of the things that we laid out as being essential services ensure that those essential services go on. So I'll give you another example. If the mayor of Greenville, any other mayor, says that every grocery store in his town has to shut down, that's in violation of the state order, and he or she cannot do that. And the reason he or she cannot do that is because people have to be able to get groceries. People have to be able to get goods that they need during this shelter-in-place order. Renee?
Tamara Lopez from Dalton News has a question.
Hi, Governor Reeves. Yes, Tamara Lopez from Greenville, Mississippi. Going back to Greenville, I know you spoke about how he might be in direct conflict with your executive order, but I know you did mention how local governments could make stricter guidelines included with your executive order, and I know the mayor was kind of going off of that, so I'm just kind of wondering, how is it that you would want him to proceed knowing that the residents in Greenville have not been abiding by the CDC guidelines, and also that his executive order was issued before the event with the ticketing took place, so they're actually in violation of the city ruling? How are those kind of fine points of politics supposed to play out when he's just trying to kind of figure out the best way to protect his citizens who are not really willing to listen to his guidelines?
Yeah, well, thank you, Tamara, for that question. I really do appreciate it. Again, as I just answered Ross, the individual elected officials can enter orders in their communities that are more strict than the state order. In other words, our state order did not have, for instance, curfews wherein no one could go anywhere in that community between the hours of 11 p.m. and 5 a.m. Our order also doesn't explicitly say that you can't have curfews. And so if a mayor wants to go further than we went, they have all the rights in the world to do so. However, if that same local elected official wants to say that all grocery stores have to shut down for whatever reason, the mayor doesn't have the ability to do that because we have defined grocery stores as an essential business. We have defined churches as essential because we believe strongly in the United States Constitution and the ability for us to have freedom of religion. Now, when you say, what do I think that the mayor should do? Well, I'll tell you what I did when I learned about one particular pastor down in Adams County that was trying to adhere to the guidelines, but his local elected officials didn't like the way in which he was doing it. So what I did is I called him, and I asked the pastor in Adams County, I said, sir, and several of my staff members spoke to him as well. I said, sir, I don't believe any government ought to be able to shut you down. And I believe that, and I'm firm on that, and I absolutely believe it. However, what I want to ask you to do as the governor of this state is to please not have in-person church services over the next couple of weeks because of the risk that it brings to your fellow citizens. I had that conversation with him, and he told me, he was very honest, he said, I'm going to pray about it. And he did. And he then, at my request, came and had a press conference with me a couple of days ago. He prayed for me, he prayed for the state. He was very kind to remind everybody that he didn't vote for me. That he didn't vote for me back in the election in November, and that was okay. But he also said that he was going to comply with my request because the approach that I took, which was to call him and ask him to do right, was totally different than what some of the local elected officials were doing, which was telling him what he had to do. And he has friends in other countries around the country that literally are getting shot at and stoned and cursed and everything else simply because they're trying to spread the word of God. And he didn't believe in his mind that his government would ever do that to him. And so we've got to all work together. We got to quit. Worrying about what some folks seem to be worried about, which is getting on national TV shows and things such as that. Let's just all do what's right, and let's come together and let's stay at home for the next week to 10 days, and then we'll make another decision as we progress forward on that. So thank you very much, Tamara, for your questions. Appreciate it. Thank you.
One quick question, Governor, actually. I was just curious, a lot of people in town here are kind of citing the separation of church and state and how this has been a conflict. How do you stand on that issue right now?
Well, what I would tell you is that I believe we have a constitutional right to practice our religion. I believe religious freedom is exceptionally important. In fact, during my time as Lieutenant Governor, I fought for not one but two religious freedom bills in the Mississippi legislature, and we were able to pass those with bipartisan support, several of them, because we have folks in both political parties that believe that and believe that government should not be able to shut down religious practices. But that doesn't mean that I also am not here pleading with all pastors across Mississippi for the next couple of weeks. And I will tell you, on Good Friday, it pains me to say it, but please be smart. Stay at home. Stay safe. Don't put yourself or your church members at risk for the next couple of weeks while we try to slow down the spread of this very deadly virus. Thank you.
Thank you.
Courtney Ann?
Do you have concerns about what it will look like to return to normal again, or lifting the restrictions too soon, and what that could mean both for the public health of the state and for the economy of the state?
Courtney Ann, I have concerns about every single decision I've been making for the last 4 to 5 weeks. No one has ever been governor of Mississippi and had to deal with the challenges that we face right now. We haven't had a pandemic of this magnitude since 1918 in America, and so as you can imagine, people's livelihoods were very different back in 1918 than they are today, particularly in terms of one's ability to move around. And so, yes, I'm very concerned. Look, we've had now 82 deaths from COVID-19, and Ely and I pray for all 82 families every single day. But we've also had almost 90,000 people apply for unemployment insurance over the last 2 weeks. We've had more people apply for unemployment insurance in the last 2 weeks than we had in the previous 52 weeks combined. So we not only have a public health crisis before us, we also have an economic crisis before us. And I want us to make sure that we put this system of care in place so that we can protect and ensure that every single Mississippian that can get better with care gets the care that they need. But I also am looking to make good decisions so that we can get our economy back, at least headed in the right direction as soon as possible. Courtney, we got small business owners in Mississippi that have spent 30, 40, 50 years building that business that literally within weeks could lose everything they have. That breaks my heart. And that tells me that we have got to make decisions that appreciate and properly respect the dangerous virus that is out there, but also fully understands and appreciates the dangerous economic times we find ourselves in. And so, yes, I'm concerned about every one of these things. Yes, Ross.
Are you considering issuing an executive order to shut down the state's only abortion clinic? The American Family Association in Tupelo has called on you to do that.
I have issued an executive order today that builds on the guidance that the Mississippi State Department of Health provided over the several weeks ago, that we are shutting down all elective surgeries in Mississippi for the next 14 plus days, because we are moving into our peak. As we look at the things that are needed in our state to deal with the crisis, we know we've got to have adequate number of hospital beds. We know within that we've got to have an adequate number of ICU beds and ICU capabilities. Within that, we have to have an adequate number of ventilators that can treat those patients that are needed. In addition to that, we have to make sure that we have adequate supplies of PPE that our healthcare workers can safely tend to those patients that are in our hospitals. In those four categories, one of the biggest risks that we have right now is an inadequate amount of PPEs. As we have all heard from every other state's governor, some of whom take different approaches than us, but every single one of them, the lack of PPEs is very concerning. I have spoken to many hospital administrators earlier today. I've been doing it every day, but I've spoke to many of them this morning. They relay to me the necessity for PPEs for their frontline workers. If our hospitals don't have adequate PPEs, it is very hard for us to expect, much less require, those healthcare workers to come in and take care of our patients. And so I have signed an executive order which shuts down all elective surgeries with the force of law for the next 2 weeks, just while we're going through this peak.
Does your order explicitly say the abortion clinic has to stop?
It shuts down all elective surgeries.
So
Nick from Jackson Free Press has a question. Nick, sorry.
Governor Reeves, you told me yesterday that your executive order declaring April Confederate Heritage Month is based on state statute. That statute doesn't exist. The day at the end of the month is mandated, but not the month itself. In fact, last year, Governor Phil Bryant specifically chose to declare Unity Month. Again, Mississippians have reached out to tell us that they are hurt by this declaration, especially at a time like this. What do you say to that?
Well, to be clear, what I signed was a proclamation, not an executive order. What I said yesterday and what I'll say again today is that there is a state statute in Mississippi which declares the last Monday in April a state holiday, and that's what my proclamation says. Gerald, did you have a question?
No, I was just follow up and say, so to be clear, you believe that abortions are elective procedures?
I believe that they are definitely elective procedures.
David Elliott from LOS has another question.
Hey, Dave.
Hi, Governor. Yesterday you spent the bulk of your briefing on the Mississippi Department of Employment Security and the continuing problems with folks filing for unemployment benefits. 8,000% surge in claims, unprecedented. You talked about the need for government to be nimble. People are hurting. You've waived some of the historic guidelines and rules and regulations. Do you have lawyers looking at what else can be done to streamline the system so people can get access to the money they need today?
Thank you for that question, Dave. Yes, we have a team of lawyers looking at every possible solution. I've signed, I believe, either 3 or 4 executive orders today alone, and as we move through the weekend, we have others that we are looking at. We are looking at executive orders with respect to the Department of Human Services. We're looking at executive orders with respect to bringing state employees back into the fold without having to wait on a 90-day waiting period, for instance. We've been working with the Public Employees Retirement System to look at that. We are looking at the potential of executive orders to do a wide array of things. You know, we've actually been, for lack of a better term, we've been laughing a little bit with some of my fellow Republican governors that those of us who really aren't interested in government intervention at all, but these are such unprecedented times that we're having to sign executive order after executive order after executive order so as to try to protect our fellow Mississippians. And we're going to continue to do that where it's necessary in these times. We've been in constant contact with Lieutenant Governor Hoseman, with Speaker Gunn. My team has, and I've personally spoken with them. We're making sure that they are in the loop. I've had conference calls with mayors, with supervisors, conference calls with members of the House, and conference calls with members of the Senate about each of these things that we're doing. In every one of my executive orders, I will tell you, we have tried very, very hard to have a specific time at which those EOs expire. I hadn't done it on every single one, but keep in mind that we believe that when government starts taking action which intervenes, and sometimes when the governor has to take actions to waive statutes, very rarely does a government official take power and then give it back to the people. That is not my intention at all in any of these executive orders, and so we're going to the extent possible, we're putting an end date on each of these. We will extend them if it becomes necessary, if this pandemic goes longer than we want it to, but we feel confident that we have not reached that yet.
All right, we've got a question from Jack from Clarion Ledger.
Okay.
Jack?
Hey, Governor Reeves, can you hear me?
I can, Jack. Thank you.
Yeah, I'd like to return to the Greenville incident and play a little devil's advocate. What if a group of 11 atheists wanted to get together on a Sunday in Greenville to reflect on humanist writings? Would that gathering be protected by your order?
What I would tell you is I don't think that a group of 11 of anybody that has any beliefs should get together in Greenville, Mississippi within the next couple of weeks during this shelter-in-place order. That shelter-in-place order, as it currently exists, expires on Monday, April the 20th. We have put the executive order in place to ensure that we slow the spread of the virus so that many of these other measures that we've put in place with the standard of care system does not get overwhelmed. But I do think that anyone of any religion ought to have the ability to gather, and that's what our United States Constitution guarantees.
Okay, so and just to make sure I'm hearing right, so that includes atheists too?
Well, I don't think that a group of 11 ought to gather, period. I've strongly advised against it, but I also think that anyone's religious liberties and religious beliefs are protected under the United States Constitution. Joe.
Have you all pinpointed an exact day, or is it just a range of days for the surge? I know it's pretty hard to say it was going to happen on the 16th or 17th.
Yeah, I think, Gerald, if you asked 25 experts, you'd get 25 different answers on that. What I will tell you is, if you look at the IHME model, which seems to be the model that is looked at nationally, first of all, what I would tell you is in the last 5 or 6, 7 days, they've reduced the expected number of fatalities in Mississippi by 90%. What that tells me is the actions that we are taking are working. I'm proud of that fact. But also, they said some 10 days ago that the peak was most likely going to be April 22nd or April 23rd. The most recent changes in their model now, I believe, and Jim, if this is wrong, tell me, April the 16th.
8 days, yes.
April the 16th. And so you're talking sometime within the next week. But again, keep in mind, there's a couple of dates there. One is maximum resource use, and as a lagging indicator is the maximum number of deaths that occur at any one time. The peak of the actual number of new cases and the peak of the maximum hospital use tends to come, and we're seeing that both in New York and Louisiana right now, tends to come 4 or 5 days before the maximum amount of fatalities occur, and obviously that's due to the hospital system and quite frankly the technology and the system we have in America, which even when people get really, really ill, they tend to stay alive longer than maybe some in other places. So
people have seen these makeshift graves in New York City, or these bodies being placed into freezers. Do we have a contingency plan if we do get overwhelmed? Have you been working on that?
We do. In Mississippi, we have a Mississippi mortuary response team that we've had from natural disasters. You might remember when the Marine Corps aircraft crashed in the Delta. We went with our teams to help with that. Has a great amount of capacity, but the best part of it is it's a great network with all of the funeral homes, a lot of the funeral homes in the corners in the state to maximize the abilities that we have. We don't see any shortfall in that capacity in our state.
okay, seeing no other questions, I'm going to move to the birthdays here on Friday afternoon on Good Friday. I know all 4 of these may need to go actually do some work, so if y'all need to step up and leave, you're certainly more than welcome to do so. I can't tell you how encouraging it has been for me to be able to get to a point where we've been able to bring some joy to some of the young people that exist across Mississippi that are having birthdays, who's not been able to invite their friends. So this is a small token to be able to wish happy birthday to Acri Thorne and to Stella Box, who's 6 today, by the way, to Riley Pickerel, to Cammie Wiley, to Janice Hathorne, to Jessica Jeffcoat's little girl, Faye. Faye turns 7 today. Faye, I know what you're getting for your birthday, but I'm not going to read it out here because you may not have gotten it yet, and I want it to be a surprise. Happy 8th birthday to Braxton Mann. Happy birthday to Georgia Lynn and Gabby Wade. Happy birthday, Blake, who is Miss Helen's grandson. Happy birthday, Blake. Happy birthday, Olivia, to Ethan, to Kara Martin. Happy 14th to Jessica Ragsdale, to Gabby Denton, to Hunter Avent, to Nathan Graves. Happy birthday, Weston Case Daughtry, Hunter Corson, Patience Garrett, Parker Winders. Happy number 2 to Willa James Steele. Happy number 6 to Olivia Kenyon. Happy birthday, Cal Beach, Mary Lynn Brannon, and to Noel in Amory, Mississippi. Happy birthday to Stephanie Strange Purvis. Happy birthday, Daniel Stringer. Daniel wants me to know that both of his parents are nurses. Well, thank you, Daniel, and thank you to your parents for the work that they're doing in these difficult times. To Coley and Meridian, to Brittany Hall, to Connor Steed. Connor is a junior at Northwest Rankin High School over in Rankin County and is also dually enrolled at Hines Community College. We love those dual enrollment programs. Proud of you, Connor. To Caden and Roscoe, to Nathan Woods. And by the way, when Nathan was born, he wants me to know that the year he was born, it was also Easter weekend. Happy birthday, Kennedy Burdine, to Paisley Broussard. Happy 67th birthday to Paul. Happy birthday, Martha Kate Harris, Crystal Jackson, Bryce, to Aiden Elsie, Rylan Pickett, to Tremont, to Theodore Williams, to Easton Brady, to Faith Wyndham, to Kerrigan Weisenot, and also to Bella Vanderford. Bella says she cannot wait for her birthday parade today. Classmates, friends, and family plan to drive by our house and sing happy birthday to Bella from their vehicles. Thank you, Bella. And that's not against my executive order either. Happy birthday to Maddie Middleton, who turns 13 today, to Andy Kate Pennell, to Memory Laney, to Charlotte Pennell, to Ariana McCoy, to Jayla Meeks, to Ava, to Abigail Shiner. Happy birthday to Chase Thompson. Chase says he plans to be a nurse and loves playing golf. Now to Wyatt Reed, to Thomas Pinder, to William Grant, to Dylan Yates, to Charlotte and Robert Flatt, to Myasia Robinson, and to Peyton Brown. Happy birthday. To someone who has a great name, Tate Felder. I understand Tate is an outstanding sophomore student at Mississippi State, and he plans to go to dental school. To Macy Comer, to Jamari Suddeth, to Nolan Pickle, to Sam Pike, to Riley Pickerell, to Anna Lauren Wallace. Happy birthday, Aiden Holland, Cassidy Davis, Chance Mullet, Carter Royce Wiley, Hunter Landrum's turning 3. Happy birthday, Austin Thornton, Jack Bailey, Atlee Bardwell. Happy number 9 to Cash Revere. Happy number 6 to Jace Ferguson. Happy birthday to Daniel Artman, who loves spending time with his 2 brothers. And to Dominic Leslie, who enjoys writing books. Happy number 18 to Olivia Chain, and happy birthday to Laura James, who loves her 8-month-old puppy, Charlie. Laura, thank you for being a nurse, and thank you for what you're doing to help in this crisis. Happy birthday to Alexia Davis, Colin Williams, Lillian Clark, Bree Wilson, Justin Kimbrell, Jackson Morgan, Cynthia Ware, Ava Virgilio, Hannah Camerzink, and to Dylan Walker. Happy birthday to Cambry Wiley. She's 6, and she's really sad she may not be able to graduate from kindergarten. Or maybe you'll graduate, you just won't be able to walk across the stage, Cambry. Happy birthday to Evie Beck and to Brian Kendall. Happy number 6 to Mary Copeland Sims. Happy birthday, William Scroggins. Happy birthday, Kyle Holloway. Kyle, your math teacher wants to wish you a very happy birthday. You know, that just warms my heart. We've got teachers all over Mississippi who are working overtime to provide distance learning, and they're also doing things like being kind enough to wish their students happy birthday. Happy birthday to Jace Norwood, who loves to read, and Jace misses his teachers. Jace, by the way, also says he likes to draw pictures of our president. I'd love to see one of those pictures, Jace. Why don't you mail me one? Happy birthday to Brittany Vell, Annie Haddock, Emma Catherine Johnson, Sam Laney, and Mady Beth Spencer. Happy birthday, Riley Roberts, Carly Farmer, Marquavius Jones. Happy birthday, Marquavius, and to Ava Grantham. To Birdie Zahner, who's a little girl who can outfish almost any boy. Well, Birdie, I bet there's a lot of little girls like you out there that can outfish their brothers or their cousins. Happy birthday to Kagan Moore and Nicole Oliveira. To Mikhail Perryman, to Lily Kate Hubbard, who's happy 13th birthday to you. To Jalaya Humphreys, she loves school and she misses her teacher, Mrs. Clay. Mrs. Clay, you're making a difference in people's lives. Thank you for what you're doing. And Jalaya, thank you for telling me that. Blaine Prince is in the 5th grade, has a birthday today. And to Cooper Sumrall, happy birthday. To Michelle Armstrong, Michelle is an MC alum, a wife, and a mother to Ellen Clark and Mary Cole. Thank you, Michelle. To Brittany Barnett, turns 19. She's a Lady Wolves tennis player down at Colin Community College. Happy birthday, Kayla Gilkerson and Jordan Rhodes. Happy number 2 to Bella Grace Osborne. And happy number 7 to Xavier Bishop. Happy birthday to Elijah Medlin. His grandmother cooked and served a fundraising meal during my run for Lieutenant Governor. Thank you, Elijah. Thank you to Eric Ellis, who turns 3 today, to Dennis Price Bullock and Emily Derrick and Swayze Fisher and Nova Lynn Beard. Happy Sweet 16 to Covita Dixon. Happy birthday to Tom Williams, Cooper Birchfield, Amira Tillman, to Jaron Robinson, and a happy birthday to Owen Carter, who turned 7 this week. And finally, to Miss Susan Timms, who's a wife, mother, and grandmother to Rylan and Bo. Susan, happy birthday, and happy birthday to all Americans and to all Mississippians that are having a birthday today. We're honored on this Good Friday to celebrate, and I look forward to talking with all of you again soon as we move into Easter weekend. Thank y'all, and God bless.